All right, everybody, we're back for part two of our three-part pain education series, and we're specifically talking about chronic pain. So last week we talked about the fact that people's pain is an experience. So anytime we have pain, pain is really an experience that our body has, and we're going to react in certain ways because of it. So this week I want to talk about how we might start addressing a patient with chronic pain. And the chronic pain I want to talk about is the type that's hard to define. It usually is within the lower back or upper back and neck. Research is a little bit out there on why those are the most common areas. The main idea is that there's the largest number of nerve endings and the largest nerves in those areas because of the nerve roots coming out of the spine, needing to get down to the distal end of the arms and distal ends of the legs. So that's kind of why we think it starts there. One of the things I want to talk about today is how we assess someone in that way. So one of the things we use is called the PCS. So it's a pain catastrophizing scale. It's a simple 13-question questionnaire that helps us try to determine how is your pain affecting your daily life and function. And again, I had mentioned that everyone is going to respond differently to pain because pain is an experience that you have. And with every other experience in life, it will affect later experiences as you age. So if someone had major trauma, whether it's a car accident or a near-death kind of experience, maybe once, maybe even twice in their life, or maybe they've had verbal or physical abuse when they were younger, that will all affect how their body reacts to painful stimulus. And what that scale does is it starts to get a better picture of what types of areas in your life are more affected by your pain experience. And then when we have that information, we can start addressing those areas. It might be movement. We might need to move more so your body can understand that it's okay to move and feel some of those soreness things. It may mean that we need to find another member of our team, like a counselor, to visit with and try to deal with some of the past experiences that we just maybe haven't dealt with yet. And there's some other things that we can go with education and just learning about why someone might be feeling the pain that they're in. And that alone can be therapeutic. So that's kind of the way one of the tools we would use to start assessing someone. And next week we'll talk about how we might address some of the things that we find in that assessment of someone with chronic, more widespread pain. So tune in next week. Thanks.